Kindly talk about partial and full, compensated, uncompensated. So you're going to make me work today? Okay, cool. Check it out. Let's talk about full compensation first. pH. Boom. That's it. That is it. If the pH is between 7.35 to 7.45, fully compensated. What does compensation mean? Compensation means it made up for the trouble that there was. What do I mean by that? Lungs are in trouble. Patient has respiratory acidosis. Their breathing is low. It's less than 12 per minute. They're holding on to all of that CO2. They're in respiratory acidosis. The lungs are in trouble, which is the only organ that can help. Well, not only, but the primary organ that's going to help. The kidneys. Helping is also known as compensating. The kidneys are going to compensate for what the lungs can't do. So if the lungs are in a respiratory acidosis because they're holding on to all this CO2 and the primary organ that can help is the kidney, what's the kidney going to do? If the patient's holding on to all this CO2, which is acidic, and only the kidney can help, the kidney can only do one or two things: shoot out bicarb or hold on to it. That's it. The kidneys are responsible for bicarb, just like the lungs are responsible for CO2. So if this patient is in respiratory acidosis, they're holding on to way too much CO2, and the primary organ that can help is the kidneys. What's the kidneys going to do to help? Or what's the kidney going to do to compensate? If they're in respiratory acidosis, the kidney's going to shoot out more bicarb. Why? They're trying to bring that patient back to equilibrium, right? So how do we know if the kidneys helped? How do we know if the kidneys compensated? We're going to look at the pH. If the patient's in respiratory acidosis and we want to see if the kidney did what the kidney was supposed to do, we're going to look at the pH, baby. If that pH is between 7.35 to 7.45, which is the normal level, that means the kidney did what it was supposed to do. It compensated fully because the pH is between 7.35 to 7.45. Now, how do we know if the kidney's only partially compensated? Same scenario. Lungs are in trouble. Patients in respiratory acidosis. They're holding on to way too much CO2. The primary organ that can help is the kidneys, right? Kidneys start shooting out CO2. But how do we realize, the kidney's trying to help, but it didn't get the job fully done? Look at the pH. That pH is not between 7.35 to 7.45, because remember, that patient's in acidosis. So that pH would be lower than 7.35 to 7.45. If that pH is out of range, right, and you go look to see what the kidney's doing, which means you're looking at what? The HCO3. You're looking at the bicarb. You see the bicarb elevated because remember, bicarb is supposed to be, what's the bicarb supposed to be? 22 to 26. That's their normal range. So if you see the bicarb higher than 26, you see it 27, 28, 29, 30, whatever. You see it higher than what it's supposed to be, which means the kidney's shooting out the bicarb, is doing what it's supposed to do. Then you look at the pH, and the pH is still lower than 7.35. It hasn't gotten to 7.35 to 7.45. That lets us know that the kidney's trying. And the way we know the kidney's trying is because the bicarb is elevated, but it didn't get there all the way. Why? Because the pH is not between 7.35 to 7.45. I'm going to give you another example just to make sure you fully understand it. Let's say the kidneys are in trouble. The patient's in metabolic alkalosis. Patient's got way too much bicarb. Which is the organ that can help if the kidney's in trouble? The lungs. Lungs are responsible for CO2. There's only one or two things the lungs can do. It can blow off CO2 or hold on to CO2. If this patient's in metabolic alkalosis, they're holding on to way too much bicarb, what do you think the lungs are going to do? It's going to hold on to CO2 because it's trying to equal things out. It's trying to throw this patient back into equilibrium. Normal CO2 is supposed to be 35 to 45. So you'll know if the kidneys are trying to help if you look at the CO2 and you see it higher than 35, right? We know the kidneys are trying to help. We know compensation's going on, but we don't know if it's partial compensation or full compensation. So what do? Check the pH. If the pH is between 7.35 to 7.45, the lungs did its job. It did what it was supposed to do. It brought that patient back to normal range, right? But if you check that CO2 and it's way higher than 45, remember CO2 is 35 to 45, it's way higher than 45, so it's trying. The lungs are trying. It's shooting out all the CO2, but then when you look at the pH, The pH is still higher than 7.45, which means the patient's still in alkalosis. They're not between that 7.35 to 7.45. What do we have? We have partial compensation. That's it, guys. Whenever you see that word compensation, what they're really asking you about that organ that's trying to help the organ that's in trouble, is it doing it all the way or is it doing it just a little bit? And your key is going to be that pH.